A sore throat? No big deal, right? Just some hot tea, a little rest, and you're good to go. But what if I told you that tiny throat infection could turn into a deadly heart condition? One that could leave you gasping for breath, struggling to move, or even facing heart failure. Rheumatic heart disease isn't just rare medical trivia. It's a life-threatening condition that starts with something as innocent as strep throat. And the scariest part? Most people don't even realize their heart is under attack until it's too late. How does this happen? Who's at risk? And most importantly, how can you stop it before your heart pays the price? Let's find out. What is rheumatic heart disease? It all starts with a strep throat infection. Normally, your immune system fights it off, no problem. But sometimes it gets confused, like a trigger-happy security guard attacking the wrong target. Instead of just fighting the bacteria, it starts attacking your own body, and your heart becomes the battlefield. This leads to rheumatic fever, a condition that causes painful swelling in your joints, fever, and worst of all, damage to your heart valves. Over time, this damage builds up, scarring the valves and making it harder for your heart to pump blood properly. The result? Rheumatic heart disease, a dangerous and permanent condition. Symptoms you can't ignore. At first, the signs are easy to miss, but as the disease progresses, your heart starts waving red flags. Shortness of breath. Even simple tasks leave you gasping. Chest pain, a dull ache or sharp stabs that shouldn't be ignored. Extreme fatigue. No matter how much you sleep, you're always exhausted. Swelling in the legs and feet, a sign your heart is struggling to keep up. Heart palpitations, that weird fluttering or pounding. It's not normal. And here's the worst part. Once the damage is done, it's permanent. Your heart valves don't heal on their own. Who's at risk? Think this is just some old-timey disease from history books? Think again. Rheumatic heart disease is still a major killer, especially in places with limited access to health care. Children and teenagers, because strep throat is common at a young age. People without access to antibiotics, a simple treatment can prevent disaster. Those in developing countries, where untreated infections run rampant. If you've had repeated strep throat infections or untreated rheumatic fever, your heart could be a ticking time bomb. Can it be prevented or treated? The good news? Yes, it can be prevented, but only if caught early. Treat strep throat immediately. A simple antibiotic course can stop the chain reaction before it starts. Regular heart checkups. If you've had rheumatic fever, your heart needs monitoring. Surgery for severe cases. When heart valves are too damaged, surgery or even valve replacement might be the only option. Ignoring strep throat might seem harmless, but when it leads to a lifetime of heart problems, or worse, it's a risk not worth taking. Because when it comes to your heart, there are no second chances.